works well is when your family doctor talks you up to the specialist. So I know that Pauline Parser tends to talk about me being an author. And if the specialist is a reader and a fan of writers, that really helps. And it was almost seamless. I kind of enjoyed that experience. What works less well is when there is no communication between the specialist and the doctor, which happened some years ago with a different doctor. Went to a neurologist for migraines and was prescribed beta blockers. So I was deep into a depression before I checked the side effects of beta blockers, and one of which was depression, which neither doctor had caught. I think if specialists recognize the limitations of their field, they need to maybe depend on family doctors to get a better sense of the patient and certainly the context, that in terms of where the patient is living, how they're doing, income level, things like this, so that they have a fuller picture. They have to take their cue from the patient. They have to listen and understand that very few of us want 16 things dealt with at the same time, that we need to prioritize. For myself, it's important that I be able to walk daily, and not being able to do that, peripheral artery disease, is very frustrating, and I want that dealt with. Specialists tend to have this brusqueness about them. I know they're very busy, but for those of us who come out of mental illness or abuse, the way some specialists kind of dictate can be very harmful. We had I was doing a group in a supportive housing environment, and a woman just blurted out that her specialist had said, "I'm not doing the operation unless you lose 50 pounds and stop smoking." And she had no investment in getting better. Why? He just triggered a whole bunch of stuff in her that if he had called the family physician and said, "Okay, here are some obstacles that we need to, know that know your limitations in terms of communicating to the patient. If you can't get a better sense of them, if you don't have time for that, then at least communicate with the family doctor and not give orders to the patient." We've done both training of psychiatric residents and training of new doctors. And the training has talked about poverty issues, mental illness, how people are discouraged from seeking care because of the way they're treated when they go into an office. So we've tried to eliminate that happening in my community, the mental illness community. We die 25 years younger than the general population. A lot of that is because our folks can't get into a doctor because the doctor finds often a way of discouraging their presence in the office. So I think especially for residents who may have more time than the specialists, understanding the need to be human, the need to be warm, the need not to cast judgment or speak harshly or make demands that are impossible to fulfill. But it has to be from the patient. It can never be the specialist deciding who's entitled to medical care and who's not. We had in psychiatry, we have this need to cure psychosis, especially voices, people hearing voices. If you talk to some of the patients, they'll say, "But those are the only friends I have." So we have to be aware of, how people are coping and what is a problem to them. It may not be the same thing as what's a problem to the specialist. I came across a Malcolm X quote that said, "If the I was changed to we, even illness would become wellness."